Do you struggle with nagging lower back pain that just won't go away? What if I told you that your sacroiliac joints could be the real culprit, and it's not just your spine? Stay with me as I break down everything you need to know about SI joint pain, and most importantly, how to fix it without surgery. Hello, this is Dr. Siddharth Damber from Chicago Arthritis and Regenerative Medicine. I specialize in non-surgical treatments for musculoskeletal conditions, including rheumatology, regenerative medicine, and metabolic health. My goal is to help you live pain-free and optimize your health with cutting-edge treatments. Back pain is one of the most common reasons people visit a doctor. But did you know that nearly 15 to 30% of chronic lower back pain causes are actually caused by the SI joint? If you've tried physical therapy, chiropractic care, or even lumbar spine injections without lasting relief, the SI joint might be the missing piece of the puzzle. In this video, we'll discuss what the SI joint is and why it matters, how SI joint pain differs from other types of back pain, the best non-surgical treatments to relieve pain and restore function. Let's get started. The sacroiliac joint connects your spine to your pelvis. It acts as a shock absorber, transferring forces between your upper body and your lower body. You have two SI joints, one on each side of the pelvis, held together by some very strong ligaments. When the SI joint is working properly, you don't even notice it. But when it becomes irritated, unstable, or inflamed, it causes significant pain in the lower back, buttocks, hips, and even down the legs. Most people assume that all back pain comes from the spine, whether it's a herniated disc, arthritis, or muscle strain. But SI joint pain has some very key differences. To begin with, the location of the pain is a little bit different. The SI joint pain is usually felt on one side of the lower back, near the dimple at the base of your spine. It can also radiate into the buttocks, groin, and hips. Pain with movement is also a bit different. Activities like standing on one leg, climbing stairs, or getting out of a car can trigger SI joint pain. And make note that it's not nerve pain. Unlike sciatica pain, SI joint pain does not come from a pinched nerve, so there's typically not any numbness or tingling in the feet. If your pain worsens with sitting for long periods of time, or feels like a dull ache in your pelvis, your SI joint could be the root cause. Several factors can contribute to SI joint pain. If you've had an injury or a trauma, such as a fall, an accident, or sports injury, that can lead to damage of the joint or the ligaments. Pregnancy and hormonal changes can also be influential here. During pregnancy, it's normal for the ligaments around the SI joint to relax in order to allow the womb to accommodate the growing baby. This increased looseness of the ligaments does not typically resolve on its own, and long-term that can lead to instability in the SI joints, thus leading to chronic back pain. Uneven pelvis or leg length discrepancy is another reason why the SI joint can get stressed out. If you notice that one leg is a bit longer than the other side, that can frequently put more stress on one of the SI joints. And then, of course, there's also inflammatory conditions. Conditions like autoimmune conditions such as ankylosing spondylitis can inflame the SI joint itself. In addition, poor posture and a weak core muscles with lack of stability around the pelvis and the hips can lead to chronic irritation of the SI joints as well. So how do we diagnose SI joint pain? Diagnosing SI joint pain isn't always straightforward. It's often mistaken for lumbar spine issues. Here's how we pinpoint SI joint pain. On a physical examination, tests like the Faber test or the sacral thrust test can help to reproduce pain. Imaging, X-rays, MRIs, or CT scans can rule out spine problems, but they don't typically show SI joint dysfunction. The one exception would be if you have significant arthritis or inflammation in the SI joints. That might then point out that the SI joint is involved. But usually, if there's SI joint dysfunction, the imaging is actually normal. And then, of course, there's diagnostic injections, where if we inject a little bit of a numbing agent into the SI joint, and for several hours to a day or two, it relieves your pain, that can also help to confirm that your SI joint is the source of your pain. The good news is that most SI joint pain can be managed without surgery. Let's go over the best treatment options. To begin with, exercise and physical therapy. Strengthening the muscles around your pelvis and hips is key to stabilizing the SI joint. You should try core strengthening exercises such as bridges, planks, and dead bugs to help support the pelvis. Hip mobility work is also key. Stretching the hip flexors and piriformis can help to relieve tension around the SI joint also. And pelvic alignment techniques. Physical therapists can use manual therapy to improve alignment as well, which can also take stress off the SI joints. You should also make posture and movement modifications. For example, avoid prolonged sitting. Consider standing up and moving every 30 minutes. You should also try to use proper body mechanics when lifting heavy objects. And then also consider when you're sleeping, if you're sleeping on your side, to have a pillow between your knees to help keep the pelvis aligned properly. If physical therapy alone is not enough, injections can help to reduce pain and inflammation chronically as well. The injections that I recommend, rather than steroid injections, which last short term, would include more regenerative medicine treatments. Prolotherapy is where we take a concentration of dextrose or sugar water. It's a regenerative injection that helps to strengthen the ligaments that support the SI joint. Platelet-rich plasma, or PRP, is where we use your own healing factors from your blood and platelets to reduce inflammation and promote repair. And then even sometimes we'll utilize bone marrow-derived stem cells, where in severe cases, bone marrow-derived cells can better help to treat damaged tissues in the SI joint. There are some supplements and nutritional options as well for general joint health. Omega-3 fatty acids can help to reduce inflammation. Collagen and vitamin C can help to support ligament and cartilage repair. Magnesium helps with muscle relaxation and reducing cramping. And bracing and supportive devices can also be useful. A sacroiliac belt can provide extra stability, especially if you have significant SI joint hypermobility. Note that the SI joint belt should not be a replacement for doing the appropriate strengthening exercises, because the right strengthening exercises can give you the right sort of stability that you need long term. Surgery is rarely needed for SI joint pain. Some surgeons may recommend SI joint fusion, which permanently locks the joint. That can help to reduce the pain, but this can lead to other potential problems. For example, it reduces mobility in the pelvis. It can increase stress on nearby joints, leading to future issues, including arthritis in the lumbar spine or in the hip joints itself. Because of these risks, we focus on regenerative treatments and functional movement strategies first and foremost. The SI joint is a common but frequently overlooked cause of back pain. SI joint pain can mimic spine issues but has distinct symptoms. Non-surgical treatments such as physical therapy, strengthening, regenerative injections, and movement modifications can provide lasting relief. If you're struggling with back pain that hasn't improved with traditional treatments, it might be time to consider that the SI joint is the real problem in your case. If you found this video helpful, don't forget to like, subscribe, and share it with someone who needs it. And if you're looking for expert care for SI joint pain or other musculoskeletal conditions, visit chicagoarthritis.com to schedule a consultation. Thanks for watching. Stay strong, stay healthy, and live well.